Doctor, why should people get to know the function and health of their thyroid gland? I think it's probably one that's passed over quite a bit, I would imagine.
It's like saying, why should you want to know how to step on the gas pedal when you're trying to drive? Or get the thermostat in your house turned to back up over 40 degrees. The gas pedal determines, or the thyroid is your body's gas pedal. It determines how much energy you make. We have plenty of calories. You know, this is the first time in human history we have high calorie malnutrition. Most people are obese in the United States, not calorie malnourished. So what determines energy production is, do we have the machinery and nutrients and things we need to burn the calories, but also setting the thermostat or the gas pedal, into mode that says burn calories to make energy. So if your thyroid is low, you can't make enough energy. You'll feel tired.
Okay.
But other symptoms, achy, because muscles will get tight, brain fog, feel fuzzy, depressed. The weight gain is a common problem because you're not burning the calories. So, but one of the things people don't realize about is that if your thyroid, even if it's normal, but just low normal, where the doctor will say, oh, that test looks just fine. Low normal thyroid is associated with a 69% higher risk of heart attack death than having a thyroid be just in the high normal range. And if you think of statin cholesterol medications only lowering heart attack death risk by 1.2%, so, and let's put that in perspective, chocolate lowers at 25%, optimized thyroid lowers at 69%. I think I'll take door number 2 and 3.
So what are some of the ways we can boost our thyroid then?
Well, one is if you're tired, achy, weight gain, cold, intolerant, if you have these symptoms, infertility that's unexplained, a whole host of things, taking the thyroid, go to a holistic doctor, because the doctor will treat you instead of just treating the blood test. If you go to a regular doctor, the test is normal, you're fine. And we'll talk about, well, let's take a moment to talk about the problem with testing.
Okay.
The normal range for most tests is based on what's called 2 standard deviations. They take 100 people, the 95 in the middle make up the normal range. And then the highest and lowest 2.5% are defined as abnormal. So say I wanted a normal range, shoe sizes. I take 100 people to walk by in the mall. I get a normal range of 4 to 13. Say a couple babies in strollers came by, I'd get a normal range of 1 to 13. A couple Texans walked by, I get a normal range of 1 to 15. But say 4 to 13. So say you have a shoe problem, and instead of your normal size 11, now you have a size 6 shoe on. You go to the doctor will say 4 to 13 is a normal range, size 6 totally normal. That's an exact analogy to what's going on.
Sure.
So, I tease that when doctors do that, they should be forced to wear a size 4 shoe till the patient's next visit in the normal range. So the testing, doctors don't know how to interpret it properly. Testing will miss most people with low thyroid. So what do? Number one, iodine, a little bit of selenium, about 50 micrograms a day, but the iodine, I will sometimes give 1,000 to as high as 12,500 micrograms. It's 12.5 milligrams. I will not go over that. There's a product called Triiodine, either 6.25 or 12.5 milligram one a day. After about 4 to 6 weeks, that can help quite a bit. Side effects, if you're getting acne, if you're getting indigestion, lower the dose. But most people find that they will feel a whole lot better. Kelp, other seafood, seaweed, reasonable way to get iodine. A good multivitamin will supply the tyrosine, iodine, and selenium needed for function. Treating the iron deficiency is critical for proper thyroid function. So basically, good simple nutritional support. I'll give them a multivitamin, treat the low iron, and have them take an iodine for 6 weeks, 6 to 12 milligrams a day. Then I'm going to use thyroid hormone, bioidentical thyroid hormone by prescription. And these things can, it's funny how many people have come up and say, oh, this is Dr. Teitelbaum's baby, and I kind of blush. And, when patients do that, well, it's because infertility is very common. And when you treat the low thyroid, despite normal tests, and when you treat the low iron, the infertility often goes away. In fact, for those with infertility, there's an article on the website, vitality101.com. You go under Health A to Z, look up infertility, and it's going to have this entire program for both the man and the woman on how to treat infertility naturally. But please don't go around telling people that this is Dr. Teitelbaum's baby.